先是 Emanuel 教授哈 ，Rod Wang 先生哈，那大家晚安。那今天很高兴能有机会跟大家分享一个 COVID-19 的一个经验。那也感谢教授您在著作中有介绍到台湾的医疗健保系统，那协助台湾提升了国际的能见度。
Good evening, Professor Emanuel, Mr. Rowan, Aaron, and Maya. I'm very glad to have the opportunity to share with you Taiwan's experience in combating COVID-19. I would like to thank Professor Emanuel for introducing Taiwan's medical and healthcare system in your book and help Taiwan to enhance Taiwan's international exposure.
在面对疫情期间呢，我们大概就审慎以对、迅速应变及超前部署。现在呢，防疫化下，那确诊个案数现在大概是1000出头，那都为境外移入。那本土案例目前77人，那到目前没有发生大规模的本土疫情。那确诊个案中只有10个死亡数。那每10万人口的病例数在全球193国家中，我们占186名。那此外，台湾的没有采取各种封城的严厉的管制措施，那我们都正常的生活。那现在也开始少量的施打疫苗。
Compared with the international epidemic situation, under the anti-epidemic plan of being prudent, rapidly responding, and advanced deployment. In Taiwan, the number of confirmed cases is only slightly over 1,000, and most of them are imported from abroad. And so far, no large scale of local epidemic has occurred, and confirmed cases of them there's only 10 deaths. And the number of cases per 100,000 population rank 186 out of 193 countries in the world. In addition, Taiwan has not adopted a strict epidemic prevention measure, such as a lockdown of the city, and most people have been able to maintain normal life. In addition, my country has also successfully administer the vaccine.
因为我们在健保卡的运用，当然是因为我们全国大概都是全部都纳保，所以全国的人都有健保卡住在台湾的。那上面都有一个医疗的记录那我们也把一些旅游的相关的记录放在健保卡里面，所以在第一个时间，当病人有医疗的需要给医生看的时候，就能够看到他的一个旅游的相关记录跟他的就诊记录，那有助于第一线的医疗人员对于整个他症状的一个判断，那如果需要的话，就可以去做筛检。那透过这样的一个系统那就是在民众能够很快的被判断说有没有染疫的可能，进而有筛检，那把它排除或者确诊。
Okay, our health insurance card contains certain information, including their medical histories, as well as we link it with their travel history. So when the medical institutions receive the potential patients, once they insert the medical cards, they will know exactly what kind of medical condition they have had and also their travel history. So our medical staff knows immediately that if this person is of a certain risk and can screen them immediately.
那另外在一开始的时候，因为口罩的缺乏但我们也希望说大家都能够有一定数量的口罩，所以我们就运用了健保卡做这个口罩实名制。那你拿健保卡就可以买到一定数量的口罩，那确保大家都有口罩可以用。
So in the beginning, there's a panic for the mask, as the mask was not available in a lot of places. So we use the National Health Insurance Card to make sure that that we identify the person who has the rights to purchase the card, and the amount can be purchased through the registration within the card.
那健保的系统也在它的首页上面经常就可以公布我们不管是在检疫上的要求、医疗上的指引，那或者检验的 标准规格，都可以在我们的健保的界面里面，让医疗人员全部在第一个时间快速的可以看到，那跟中央的步伐可以一致。
And and all the relevant guidelines from the government are constantly updated in our National Health Insurance Administration's websites, and so that all the protocols that can be followed by our healthcare professionals as well as people in general in Taiwan.
那另外一方面，在远距上面，我们因为有很多的检疫的人那他居家里面不能出来，那但是也有医疗的需求，那避免跟大众做过度的接触，所以我们也建立了居家检疫里面远距医疗的系统。
And also because there are a lot of quarantine individuals that still need some medical care, so we set up the telemedicine procedures for those quarantined at home.
那大家经过远距医疗的诊断，那就可以做一个比较完整的转诊，那可以说避免大量的跟这个一般民众的接触那避免这个疫情的扩散。
So through the diagnosis with the telemedicine, so those in need of medical care can be successfully transferred into the medical facilities. So that way we'll avoid direct contact with the general mass.
那至于在长照上面，那当然我们就有发布了很多相关的照顾的指引，那怎么样让这个照服员那能够比较好的照顾，又避免把病菌带到机构里面来。所以在机构我们也限制访客。那第二个，那在发生状况的时候，我们也迅速的隔离。
As for the long-term care facilities, now we have announced a lot of guidelines for the caretaker as well for the institutions, so that we make sure that the caretakers and the facilities are well protected, and we also limit the number of visitors to these facilities to make sure that no unnecessary contact are happen.
那当它发生状况的时候，我们也要迅速的反应。比如像去年我们就有一起的在长照机构的里面的一位照护的护士，那染疫，那我们迅速的做了疫调，在一个晚上的时间就把所有的相关居住者都移到外面，然后一人一室的去做隔离。
And there was a case that there was a nurse that was infected with the COVID, and so that in the first moment that we did a very thorough investigation of the institute as well as all the person that were in contact with the nurse, and we resettle all the residents into other institutes that are safe without COVID.
那这个都是很迅速的，除了照顾者跟被照顾者，我们全部都隔离开来，然后从外面再调一批新的护理人员进到里面再做个人的一个照顾服务，让这样的一个照顾不中断，那也把防疫能够做好。总之，在这经验里面，我们认为说迅速的行动是一件非常重要的事情。
So that we could have the care, we could take the care as well as the patients that taken look after, and so we did all that overnight. In the case of the nurse that had contracted COVID in the nursing homes, so one of the very important lessons and the way that we handle this is a very rapid response to the early symptoms of the situations.
And was that the only infected nursing home?
Only one.
Yeah, that's the only one. Yes.
On the use of telemedicine, is it going to stay up or is it going to keep going down?
有关这个通讯医疗是部长是认为会持续的上升还是会下降？
通讯诊疗当然是我们持续要发展的项目不但是在 COVID-19 疫情期间，那未来 我们也会发展更多。那现在我们把远距医疗也纳入我们健保的给付。
Okay, so prior to the COVID-19, the telemedicine has been part of our ministry's policies. And so we are doing a lot of infrastructure building as well. So he expects the usage of the telemedicine to go up. And as well as now, part of the telemedicine is covered by our national health insurance as well.
Do you pay the same amount as going to the doctor, or you pay the doctor less for it?
给付的方式是不太一样，你要不要稍微做一点简介？那我们现在开始是对于所谓的一个偏乡偏远的地区，先开始做这些给付。那至于给付的内容，我们等一下请同仁再说明一下。
那目前我们健保给付这个远距的部分，就如同部长讲的，先从偏乡跟偏远的地区开始。那所以有60个乡镇，那我们大概就是用论次或者是论诊次跟论人次的方式。那如果是每诊的话，我们大概就是5000点；如果是论人次的话，就是每一个人次是500点。那另外的话，我们现在就是除了地区限制之外，我们也是先从眼科、耳鼻喉科跟皮肤科开始，那就会慢慢的每一年的话会去做一个检讨跟调整以上。
Okay, so right now it's our policies begins with the mountainous and the remote areas, some offshore islands. So the way they are paying it is slightly different. So if they pay doctors either by per session or by person. So by session, they'll pay them 5,000 points, which is roughly equivalent to 5,000 Taiwanese dollars. That's like 150, 170 US dollars. And per person, they pay them 500 Taiwanese dollars. So that's about $15, $17 US. So right now they have implemented in 60 of the villages. So that's more and the remote areas. And they begin with the 3 specialties, the ophthalmology, the ENT, the dermatology. But we will open up the state by different specialties as time progresses. And so we are doing rolling reviews on these policies.
You've been a quite successful minister of health. If we had to say, what do you think the essence of Taiwan's successful response has been? What's the most important thing Taiwan did? The most important things that Taiwan did for a successful response?
OK，部长，你是一个非常成功的这个带领我们台湾防疫的部分。那在你的观点里面，你认为是哪几个最重要的元素，能够让您这么成功的在台湾政府这么成功的防疫？
好，当然我们觉得最成功是因为我们政府跟人民都站在一起，我们资讯非常的透明，那建立人民对政府的信心，所以就全民的行动一致，能够成功的抗疫。
To him is that there's 2 factors. One is the government and the civilians, the people that collaborates together, and all the information has been very transparent, and so that the level that people trust the government is extremely high. So
第二个就是我们在重要在做的时候，我们做等于是一个精准的防疫，我们不做大量的筛检，那我们针对有症状的，然后做好从它的一个检测到疫调都很完整的来做。但我们并不采用这种大量筛检的方式来做，那避免掉很多的困扰。
And secondly, that it's we call it the precise inspection of the diseases. We do not do the massive tests of general population, but when we have a suspect cases, well, we do a very detailed and thorough inspection of it, and we do the surveillance at a very, very detailed level.
那总是我们就是把一些相关简单的事情，但是做得很有效率、很确实，那这样子让我们能够成功的抗疫。
In other words, that we do some very simple things, but we did it very efficiently and effectively, down to the every detail, to make things successful.
How did Taiwan support people in terms of income and other things? Was that important or not important?
就跟你针对一些比较需要帮忙的人，这个我们的政策是如何？
当然我们有发行了3倍券嘛，那对于人民的一些相关的经济的支持，但是台湾并没有因为疫情而造成大量的工作的停止，所以我们用这个有限的金额就能够达到帮助整个经济活动热络的目的。
We do have some.
那边先讲，你继续。
We do have some policies, including something called the triple coupons, where the people pay 1,000 NT and they will get the 3,000 NT back. So that's what we call triple coupons. And however, because we in Taiwan the economy has not been too much affected, so we were able to use limited resources and to achieve the revitalization of the economy.
What is the plan on vaccines?
有关疫苗情况。
在我们在去年对疫苗的等于是一个战略的考虑我们当然希望这前半年是能够用国外的一些相关的疫苗能够快速的替人民来打。那下半年之后，我们希望能够发展我们国产的疫苗。
So our strategy is like this: for the first half of the year, is that we are using foreign vaccines, and at the same time that we are also developing the domestic vaccines. So in the latter half of this year, that we're hoping that we will have a domestic vaccine for most of the people.
那不过在购买国外的疫苗本来是预计上半年能够比较充足一点，可是在后来也是因为我想是国际疫苗的短缺，所以我们在购买疫苗在上半年进来的疫苗的速度不如我们所预期。那不过因为台湾目前疫情还好，所以也没造成很大的恐慌。那但是要达成一个整体的疫苗的一个群体免疫，仍然是我们的目标。
And because of international situation, that we have not been as successful as purchasing the vaccines internationally, but much less than we have expected. However, because the relatively low number of cases in Taiwan, now we were doing quite okay.
台湾也有自己发展，我们有2家公司那现在都在2期的临床实验中。那我们对它抱以很大的希望。
Okay, for the domestic vaccines, that we actually have 2 companies that are in the phase 2 of a clinical trial, and he's very hopeful that these 2 companies will successfully went through all the process and be available to the people.
Where are you conducting the trial, since you can't conduct them in Taiwan because you don't have enough cases?
当然等一下我们请这 FDS 也请那个。让他说就是我没有办法做3期，我们大概怎么弄
？Yes, right now in Taiwan, we don't have such environment to have such clinical 3 phase 3, but we try very hard. So in Taiwan, we have some methods to detect the antibody. We know when the vaccine have the antibody, this one can have some protection, but we must ask how much the antibody can reach our expectation of protection. So we have some method to detect the antibody, but we also have some other plans to go to other countries. Some countries that's suitable for such phase 3 trials. So it's simultaneously be performed.
So, okay. So inside Taiwan, you're assessing it by antibody production, but you're still going to do a traditional trial in a country that has a high COVID rate, so you can actually see if the vaccines prevent COVID.
Yes.
对，因为我们在一开始我们在传染病防治法我们就修订的算很完全，所以我们指挥中心里面就包含了所有的各政府各部门，所以我们在任何的时间，在第一个时间都可以跟所有的部门一起召开会议，共同再把我们的政策能够决定下来。在我们在紧急的时候，我们很多的政策大概都在半天内就做好了。
Okay. According to the infectious laws that when we last amended, that we have set up this command center. So once this command center is kicked off, different ministries within the government are all included in this command center. So all the policies that are most of the policy are made within half a day. So the decision making is very quickly.
What other ministries were included?
所以当然，所有的部门，所有政府的部门都会包含在我们指挥中心里面。
All ministries, all the ministries, from economics, finance, whatever, all the ministry within the government structure.
And when was this command center structure initially started?
我们在去年1月20号3级成立，那到了2月27号就1级成立。
So the command center, the third level of command center initiated on January 22nd of last year. And the second level of command center initiated on the February 27th.
What does the minister think Taiwan has learned about responding to pandemics that will change the response to the next pandemic?
部长，有关有没有学习到这次的疫情对于下一次或许有没有什么的学习到的东西？
第一，我觉得全世界在这个疫情那应该要更公开透明的那每一个国家都有责任，在发现任何的一个情况，不要试图去掩盖这样的一个可能的传染病，应该尽速的来报告出来，让大家都有一个准备。
First of all, I think that for the next pandemic, that the whole world should be very transparent about the situation and do not try to cover up any of the information that is important to the potential epidemic.
然后对于相关的一些，不管是一些防护的装备，那或者就是说像疫苗，应该有一个更公平、更合理的一个分配的平台。
And for medical equipment and materials like masks and personal protective gears and even vaccines, there should be a more fair distribution platforms for all the countries.
那第三个，这应该是要对各种的不同的社会的制度，大家可以来做一个更多的讨论。那看在制度上面有哪一些可以做改善，那互相可以接近参考，那能够更有效的对抗疫情。
And it's also important to study the different social structures in different countries, so that how we can collaborate with each other to best attack the epidemic.
然后最后就是大家都要重视说对于环境的破坏，那所可能造成这种各种疫情的传播，那对于自然的尊重，我想要更多一些。
And lastly, that we must respect the environment.
Is there anything the minister would do to change the Taiwanese health system or public health system?
那尤其在这次的疫情里面，我们这个公部门的医院就发生了很大的一个效果。那行动因为指挥相关的都比较直接，所以行动非常的迅速，让体会到公部门的医院未来也许是我们应该发展的一个重点。
And during this epidemic, the governmental hospital actually did most of the heavy liftings. And so we realized that because of the effectiveness of the ordering from the governments, so so that we realize that the government hospital are very important to our system. So in the future that we might further develop the governmental hospitals.
Two things where I basically see Taiwan being very unique in terms of the approach we took compared to other countries, right? One is in the area of testing. The general rule that you hear is the more testing you can do, the better. Okay. However, from my understanding, the Taiwanese government does not believe in that. It believes more and more targeted. So can you talk a little bit about how that worked well for you? And will you continue to take that strategy, or are you modifying that? And then number two is, you're one of the extremely lucky countries that didn't have a lockdown, right? Was lockdown ever on the agenda, or you do not believe in lockdown?
OK， 当然台湾没有做大规模的这种检测哈，那最主要是我们第一条非常坚强的医疗的防线，大家接触到医生的机会非常的多。第二个是因为在检测里面有太多，一开始那个检测试剂都是非常的不是那么的精准，那产出了很多的伪阴性或伪阳性，那反而让这个整体的防疫的工作变得更困难。
Okay, for the first question is that, first of all, Taiwan people do have very easy access to the medical professionals, so that we do have a very solid front line. And in early on, that we do find that the testing, the mass testing, that the kit that do the mass testing that turn out a lot of false positive or false negatives. So it wasn't very useful, and it create unnecessary chaos to the overall plans.
那整体在这个检验这件事情，我们那时候有很仔细的观察了钻石公主号所发生的一些情况，然后发觉其实这样的一个检验如果没有做好后续的隔离，坦白讲是没有意义的。
And also for the lockdown that we took the study of the Princess Cruise that was on the offshore of Japan, that we know that unless the quarantine is very well executed, that we find that it's not going to be effective.
那第二在封城，因为台湾疫情没有那么严重，那没有边境封锁没有想过了哈。那但是封城，台湾的内部的封城是从来没有必要过。
Closing the borders has been the thoughts, but the internal lockdown, because the situation was never crossed his mind.
Do you believe that this is the right philosophy to take, or there are much more better ways to handle or implement your strategy without having to think about lockdown?
就像部长有觉得说，这个是这个封城，这是一个是有其他方式比这个封城会更有效，就是这个。
封城其实在我们认为是，在我了哈，认为是一个冒险的行动了哈，因为它要极端的强制力才会有效，可是极端的强制力也带来极端的反弹，那是会把这样的一个隔离的效果就消灭掉了。所以封城的手段，基本上我认为，除非是集权的国家才比较有可能把它做好了哈。那民主的国家采用这样的方式，恐怕都很困难。
To him, the lockdown takes a lot of efforts and extreme of enforcements. So that when you have extreme enforcement, you sometimes can be counterproductive. So to him, that the lockdowns might only be really successful in more authoritarian states, and in a democratic country like Taiwan, that's the social price are too high, and so it might not be as successful.
那我们自己做的是居家隔离很多了哈，我们做了很多的居家隔离，到目前大概有60万人是隔离开。但是我们除了有法律的规定之外，那也用了很多的关怀的方式， 好，那让被隔离的人愿意跟我们配合。
And so far in Taiwan during the epidemic that we have home quarantined 600,000 people. And other than using the law enforcement, we also has a lot of methods such as caring and providing services for those home quarantines, even some financial compensations.
What made you close the border, and how hard a choice was it?
这对于这个边境这部分，那是不是很困难？
当然这个决定都非常的困难。我们在去年大概3月21号吧，好，我们是全部的，都就不准这外国人入境，哈。
Okay, it was a very hard choice that we closed the border on March 21st of 2020.
那所有的入境的旅客都需要做居家检疫。
And all entries needs to be home quarantined.
那但是我们很快的就对相关的需要做这种贸易，需要有这样的生意的往来，那有人道的需要，那我们就逐渐很快就把它开放来。
And we also realized that there are people that needs to do business, and also for humanitarian reasons, that very quickly that we lifted the closing of the border.
所以基本上它在边境的管制大概就是主要是对于非必要的旅游了那对必要的应该是说非必要的旅游是禁止那必要的往来我们是开放。
And we pretty much prohibited the unnecessary travel.
Is it once everyone in the country is vaccinated that you foresee loosening quarantine for people who are coming into the country?
如果大家都疫苗都注射了，那是不是就会就对居家检疫的部分就会放松？
当然，在理想的情况如果能达到社会的群体免疫，那当然就没有必要的一个隔离。那不过我认为每个国家要达到一个社会的群体免疫都会非常的困难，所以大致上我想未来开始打疫苗之后会缩短检疫的时间了但是要完全的放开来，恐怕不是短时间可以做得到的事情。
Ideally, that we need to reach the herd immunities, and it's actually very difficult for every country to reach the level of herd immunities. So once most of the people are vaccinated, that he expected to shorten the time frame for the home quarantines, but to lift it all might be something further to consider.